Hello, friends. Today we will talk about Sangobion capsules, what they are, their correct method of use, their benefits, recommended pregnancy, and finally, their possible side effects. We'll also discuss who needs to use Sangobion capsules. In this video, I will give you complete information. Sangobion capsules are manufactured by the multinational company Martin Dow. If we talk about the price, you can easily get one pack from any medical store for around 100 Pakistani rupees. Sangobion capsules contain iron plus folic acid with vitamin C and vitamin B12. Let's look at the ingredients present in each capsule. Ferrous gluconate, 250 milligrams. This is a form of iron used to treat iron deficiency and anemia, low hemoglobin, or lack of healthy red blood cells. Manganese sulfate monohydrate, 0.2 milligrams. Used for short-term relief of mild constipation. It can also help reduce minor muscle pain, joint pain, and leg pain. Copper sulfate, 0.2 milligrams. Copper is a mineral found throughout the body. It helps the body produce red blood cells and keeps the nervous and immune systems healthy. Vitamin C, ascorbic acid, 50 milligrams. A powerful antioxidant that protects your cells from the effects of harmful free radicals, supports healthy skin, and may help reduce the risk of heart disease and certain cancers. Folic acid, one especially important for women. If a woman has enough folic acid before becoming pregnant, it helps strengthen the baby's brain and spinal cord and reduces the risk of birth defects. This is why doctors recommend that women take folic acid before pregnancy and continue for at least 3 months after pregnancy begins. Vitamin B12, cyanocobalamin, 7.5 milligrams. Helps reduce nerve inflammation, relieves migraine headaches, improves brain health, and helps prevent constant headaches. Precautions. People with kidney disease or those with stomach or intestinal inflammation should use Sangobion capsules only with their doctor's advice. Correct method of use. For maximum benefit, take 1 capsule on an empty stomach with a full glass of water, preferably in the morning before breakfast. If you have already eaten, wait at least 2 hours after a meal before taking the capsule, or use it exactly as advised by your doctor. Possible side effects. Some people may experience constipation, stomach irritation, nausea, vomiting, or allergic reactions such as difficulty breathing or swelling of the face or lips. If you notice any of these symptoms, contact your doctor immediately. That's all for today's video, friends. If this information was helpful for you, please like the video, subscribe to the channel, and press the bell icon so you never miss new updates about health and medicine. Thank you.